My name is Anya, and I'm a registered dietitian with Fraser Health in British Columbia. Today we'll be talking about tube feeding at home. In this video, we will walk you through the steps to feed yourself using a feeding pump. Please refer to the booklet provided by your dietitian that includes information specific to you. To make the process easier, gather all of your supplies before you begin your feeding. You will need 1 syringe, a container filled with room temperature tap water, your formula, an IV pole, a feeding pump, a spike set or feeding bag with tubing already attached, and a small towel to cover your lap to catch any drips or small spills. Wash your hands before you begin feeding yourself. This will help keep your supplies clean and prevent the transfer of potentially harmful bacteria that could make you sick. Priming your tube means that you let the formula run through the feeding bag tube to remove air before you begin feeding yourself. If your formula comes in closed system bags, remove the cap from the bottom of the bag and push in the spike set. Twist the connector until it clicks and the spike set is well secured. If you are using boxes or cans of formula, pour the recommended amount of formula into a feeding bag with tubing already attached. Hang your feeding bag on your IV pole. Next, connect the feeding bag tube to the pump. There are several types of pumps available, so follow the manufacturer's instructions to connect and prime your feeding bag tube. Position yourself to be upright during feeding. Whether you sit in a comfortable chair or at a kitchen table, the idea is not to be lying flat. If you are in bed, use pillows to prop yourself up to at least a 30-degree angle. Try not to slouch or lie flat, as this could result in formula going up into your esophagus or even into your lungs. Place the towel on your lap. Flushing your G-tube before feeding yourself helps to clear anything that might be blocking it. Using your syringe, draw up the recommended amount of water, or at least 30 milliliters, from the container. Clamp or pinch the G-tube with your fingers to prevent stomach content from leaking out. Uncap the feeding port and insert the tip of the syringe. Release the clamp or unpinch the G-tube before gently pressing the plunger to push the water through. Once again, clamp or pinch your G-tube before removing the syringe from the feeding port and replace the cap. Clamp or pinch your G-tube before you remove the cap of your feeding port. Connect the primed feeding bag tube. Unclamp or unpinch the G-tube. Check the pump settings to make sure that it is set at the recommended rate and volume that was determined by you and your dietitian. Press start. When your feeding is complete, clamp or pinch your G-tube, disconnect the feeding bag tube, and cap your feeding port. The final step is to flush your G-tube once more to clear it of all the formula. This will help prevent a blockage. Follow the same steps as you did to flush your G-tube before you started feeding. Your feeding is now complete. All that is left to do is clean and put away your supplies and remain upright for at least 30 minutes. If you experience any issues with your feeding, contact your dietitian or your doctor.